Okay, hello, good afternoon, everyone. Everyone can hear me? Is it loud and clear? Is there any discrepancy in the audio?
Yes, can doctor.
All right, good. Okay. Right, welcome everyone for our session today. And thank you so much for joining the program with us in International Academy of Advanced Aesthetics. I'm Dr. Warren. There's a little bit of introduction. I've already told by Ms. Suba. I'm a primary care dermatologist. I'm a clinic based in Bandarimbayu. So we here see mostly skin disease cases and skin pathology. Other than that, we also cater for general practice sessions as well. Okay, I'm an advocate of hair regrowth PRP therapy as well as PRP for knee osteoarthritis as well as any sports injury related to knee. Okay, that's a little bit of introduction to myself. Now let's straight go to the topics. The topics given to me today, first of all, we're going to talk about safety and hygiene. All right, so we shall start. All right, Mr. Renuga, the next slide, please. Next slide. Okay, these are the objectives. Uh, out of all the objectives here, we're going to identify hazards in the premise, carry out simple risk analysis, follow safety and hygienic working practices, outline the main provision of health and safety legislation according to national law, of course, differentiate between antiseptic, aseptic, sterilization, and equipment or product involved. So all these terminologies are very important. I hope at the end of the session we'll be able to differentiate what this for actually means. State the procedure for dealing with accidents and emergencies, carry out workplace upkeeping preparation, and adapt personal hygiene and safety in performing aesthetic procedures. I'm very sure that we practice aesthetic and we do procedures every day. So safety and hygiene is very, very important for us to be able to make sure that our therapy or our treatment is efficient, at the same time maintaining the safety of ourselves as well as our clients, and also the hygiene part. Hygiene usually relates to us and our surroundings, our practices, and so on. Okay, next slide, please. Next. All right. This is the definition of safety. Safety is a condition of being protected from harm or other non-desirable outcomes. In medical field, safety can be also referred to control of recognized hazard. Meaning in medical, the danger or the precautionary measure is inevitable. So it has to be there. Danger is persistently there. So the process of controlling the recognized hazard in order to achieve an acceptable level of risk is also classified as safety. Meaning, the danger is there, but we make sure that that danger is only to a certain amount as it cannot affect us majorly. I hope you understand that. Safety is not only applicable to protect customers, but also therapists ourselves. Other than safeguarding our clients, we also must safeguard ourselves. Okay, next. All right, these are the checklists of what we need to do. Identification of checks, personal information security, infection control procedure and policies, electrical appliances check, and medication safety. All these checklists are what we need to what we need to do in order for us to maintain the safety and hygiene. Okay. All right, next. All right, infection control. It's one of the most important part of safety and hygiene. Infection control procedures and policies and staff take every precaution to avoid infection. However, the risk infection can never be completely eliminated. And some people have a high risk of acquiring an infection and others. Meaning, risiko akan sentiasa ada risiko untuk dapat infection is always there. So apa yang kita patut buat adalah untuk memastikan percentage risiko adalah kurang. They just say like for currently for COVID, right? So dia orang cakap risiko adalah tinggi untuk orang-orang yang berusia dan untuk kanak-kanak. The same thing. Semua orang akan dapat infection, tapi risiko dia berbeza. In safety and infection control, we must make sure that kita kurangkan risiko tersebut. Okay, I hope you understand that. All right. Okay, next. All right, recognized medical waste and biohazard waste. Okay, in a practice, in all aesthetic practices, aesthetic clinics, or any general normal clinics, kita ada biohazard waste or medical waste. Maksudnya, benda-benda yang kita buang. Apa-apa benda yang kita buang keluar daripada klinik or medical clinic or medical practices, it should have a waste. So whatever we throw out, we consider it as a waste. So waste usually have two types of main wastage. Meaning, number one would be biohazardous waste, and number two would be medical waste. The difference between biohazardous waste and medical waste. Biohazard waste is also called infectious waste, such as blood, body fluid, and human cell lines. It's a waste contaminated with potentially infectious agent. All right, but potentially infectious agents and other materials that are deemed to threat the public and environment. So anything which has blood, body fluid, and human cell lines like tissues or dead cells and everything, pus. When you do dressing, we have pus, all are considered biohazardous waste. Okay, and number two is medical waste. Medical waste is a general waste of whatever comes or whatever has been thrown out of our practice. That's medical waste. So there are two types of waste and there are two types of disposal of the waste as well. Dua jenis bahan buangan daripada klinik at the same time. Cara kita untuk buang dua benda ni pun ada cara yang berbeza. It's not the same. It has a different method of disposal. Next slide, please. We shall look at the ways of it's been disposed. Next slide, please. All right, disposable method. As I told you, contamination determines the disposable method. Contamination must be collected by a biohazardous waste hauler. So semua jenis, all the wastes which thrown out of our practice and it's considered biohazardous, meaning which has blood, body fluid, and skin, has to be collected by a licensed waste hauler. Kita tak boleh nak simply go and throw it in in a dustbin, or kita suruh orang ambil sampah kutip benda tu, tak boleh. It should be collected by a waste hauler. All right. So all the clinical practices whatsoever must engage themselves with a licensed waste hauler so that the waste which contains biohazard specimens or materials can be collected by them, and it should be disposed in a proper manner. Okay, non-contaminated waste macam bahan buangan yang lain yang tak ada darah, pus, any tissues, tak ada apa-apa kaitan dengan badan kita, boleh dibuang dengan cara yang kita buang sampah biasa. Okay, the non-contaminated waste can be disposed as a medical waste by our normal way of disposal, by throwing in the rubbish. But make sure it is well secured. The plastic bag should be well kept and well tied before you dispose it. Okay, I hope you understand that. Next slide, please. All right, these are the types of biohazard waste. All right, sharps, including needles, blades, and slides. Dry biohazardous waste like contaminated cultures, petri dishes, infectious agents, wastes from bacteria, virus, spores, or live and attenuated vaccines. Waste contaminated with excretion, exudate, or secretions from infectious humans. Paper towels, bench, or any items contaminated with biohazard waste. So paper towels, bench, and whatever not be used to clean up any mess by the patient, sweat or blood or pus is considered biohazard waste. Okay, liquid biohazard waste, which is human blood elements or human bodily fluid and semi-liquid materials, and also human anatomical specimen. Like in some clinics, we do excision, meaning we chop off things like a dead nail or dead necrotic tissue. So all that are considered biohazard waste. In hospitals, when you chop off one's fingers or foot or whatever parts of human, it is considered anatomical specimens. All right, next. Next slide, please. All right, here, medical waste. Medical waste is all the other wastes, meaning non-contaminated culture, petri dish, and other culture flasks. Non-contaminated, meaning it's new. You haven't used, you can throw it out. Non-contaminated syringes. Syringes which is not been used, you can throw, but not needles. Needles, you have a special way of disposal. We call it a sharp bin. You dispose the sharp bin in, we dispose the needles in a specific sharp bin, and the sharp bin should be collected by a licensed hauler. Okay, even though the needle has not been used, it should not be disposed as a normal medical waste. Decontaminated or dry biohazard waste, empty specimen containers, bandages, trace chemotherapy waste, including empty containers and IV tubing, and also any material resulting from medical care that is not biohazardous. So semua jenis dressing atau bandages atau plaster atau kain atau tisu yang kita guna tapi tak terdedah kepada darah, peluh atau apa nama tu nanah, can be waste, can be disposed as a medical waste. Boleh didispose atau dibuang ikut cara yang biasa kita buang sampah biasa. Okay, all right, next slide. Okay, these are the bins. Okay, I told you the bins. Atau these are the bins that we use to dispose specific types of wastes, like cytotoxic drugs. Cytotoxic drugs meaning drugs which is toxic to our cells, to human being, and chemical wastes. We use a black dustbin. A red dustbin is for infected dressing or POP cast. All right, we use it, a red bin. The yellow bin is one of the most common bins we use in our practice. We use it for anatomical wastes, like any bodily fluid, any disposable materials that we use that it has been contacted with bodily fluid, blood or pus. We use a yellow bin, and the blue bin should be for syringes, gloves, and plastic waste. But it's very rare. The most common thing is we use a yellow bin. Yellow bin, it's a must for any medical entities or any practice which does medical services, clinics, aesthetic centers, or not salons. But if you do invasive or minimally invasive treatments, you should have a yellow bin for you to dispose all your biohazardous waste. All right, the next. All right, these are the examples of the bins, but not all we use, but these are the examples of, you can see some sharp bins there and various type of bins, which all is considered yellow bins, but it comes in a different size. All right, next. Yes, this is what I was telling you about, sharp bin. Okay, benda-benda yang tajam kita akan buang ke dalam sini. This is only for needles. You do not put in the whole syringe inside there. Only the needle, hanya jarum. Picagari atau syringe kita tak buang dalam ini, unless it is it has blood inside. You can choose to throw it in. Okay, next. Okay, these are the safety precautions. So when we do procedures or when we do any types of surgery or any minimally invasive aesthetical procedures, what we do is we wear scrubs. All right, why we wear scrubs? The scrubs supposed to be a new or uncontaminated clothing. Okay, we won't encourage any procedures to be done by wearing just a normal attire that you wear to clinic. Okay, when we do a procedure, the procedure should be done in an aseptic manner. So a new clothing, a clean, new hygienic clothing is a must. So we wear scrubs, preferably. Some people prefer to wear scrubs or to just tug on an apron, a medical grade apron before doing any procedures. Wear caps if you have long hair. If you think that your hair will interfere in your procedure, just wear a cap. Gloves is very, very important. Wear a mask. Yep, nowadays mask is so very common. Wear a gown if you have to, and wear a closed shoe just in case with any spills of materials, any possible active bleeding, or like if you do microdermabrasion, you'll be dealing with liquids. If you have any risk of liquid spilling, please use a closed shoes. All right, next slide, please. All right, hygiene. Now we have done with the safety part. Now it's hygiene. Safety is, as I said, as we have discussed earlier, is a process of reducing the hazard. Okay, the danger is there. The process of reducing the danger to an optimum level of risk, it's called safety. Now, hygiene. Hygiene is basically cleanliness and the way you maintain a conducive working environment. Okay, hygiene. Biasanya hygiene berkaitan dengan kebersihan kita, kebersihan diri dan kebersihan persekitaran. The definition of hygiene: conditions or practices conducive to maintaining a healthy and preventing disease, especially through cleanliness, as I told you. Importance of hygiene is to prevent the spread of infection. That's the most important part of why we need to maintain hygiene. Okay, next. Next, please. All right, components of hygiene. We have a lot of hygienes. I'm very sure that you all have heard about this before. Anyway, it's called oral hygiene, hand washing, hand care is also considered as hygiene. Cleanliness of hands is very important now in daily activities. Nowadays, everyone have been encouraged to wash your hands regularly. And normal activities, our hands frequently get dirty. So there are many situations in which microorganisms are likely to attach to our hands along with the dirt. So hand hygiene plays a critically important role in preventing transmission of infection. We use our hands for all our procedures. Okay, none of the procedures that there's no any procedure that doesn't involve hands. So hands is very, very important. So hand hygiene is a very critical type of hygiene that we have to maintain every time. Okay, next, please. All right, now fingernail hygiene. Fingernail hygiene, so all are common things, but what we know is sometimes we oversee things. So when we're dealing with our clients, the clients are very, very important. So we must make sure that they feel comfortable. So when we are maintaining the hygiene, the clients will be happy to have a treatment or any type of procedures from us. So fingernail hygiene, hair hygiene is important, and clothes hygiene, of course. All right, next. Okay, all right, I can just go through this. These are the steps, the proper steps of how are we supposed to wash our hands. So if you have a background of working in operating theater before or any hospital settings before, so the first thing they will teach you when you enter an operation theater is how to wash your hands. All right, it's very, very important. These steps, each and every step of hand wash would be observed. This is very important. So over time, it will be in habit. Even after you have eaten your nasi lemak, you will always follow these steps of washing hands, like what I do. All right, next. Okay, hand hygiene. This actually applicable in hospital setting. This is the 5 moments that you have to wash your hands or apply a hand sanitizer. Number 1 will be before touching the patient. Of course, you're coming from other patient, you're coming from out. Before touching the patient, you must sanitize your hand. And before clean or septic procedure. So you just say you want to put a prendula for a patient, you want to do a lavage for a patient. Before every procedure, you must wash your hands. And of course, that one is after body fluid exposure. If anything been exposed to you, you must wash your hands. And number 4 would be after touching a patient. All right, after touching the patient, you want to leave, you have to sanitize your hand. And the number 5 is after touching the surroundings. If you accidentally touch the patient's bed, or the patient's belonging, or any materials around the patient, you must wash your hands or sanitize your hand. All right, next. There we go. That's all done. So very simple and very straightforward measures of how are we supposed to maintain safety and hygiene. Okay, this is a very general topic. You must maintain safety and hygiene wherever you go or whatever you do. That's the most important thing. And I hope you guys have an idea about what the topic was. So safety is always to maintain the hazard as to maintain the risk of the hazard. The hazard is always persistently there. It's like you have to maintain the safety precautions, and hygiene is mainly about cleanliness. Okay, safety adalah macam mana cara you untuk mengelakkan diri daripada terdedah kepada bahaya, and hygiene is basically all what we call that would be kebersihan, cleanliness. So these 2 things you must really remember. All right, thank you.